For many immigrants, a mastery of everyday English doesn't mean they feel comfortable in all settings, like in a doctor's office. That's where medical interpreters play a crucial role. But as Ali Rogan reports, access to these highly skilled professionals isn't guaranteed for many Asian American and Pacific Islander communities.
This one is good luck and happiness.
In San Francisco's Chinatown, Bi Huang sells jewelry and other Chinese goods as she has for the last 30 years.
The pearl earring, yeah.
She calls her English halting, but she's fluent in salesmanship.
Green Jay is a Chinese symbol meaning is money.
I think the key to my success is my warm and welcoming service. I try to be inviting to my clients, and I don't pressure them to buy anything.
In her shop, she strings English together as easily as beads on twine. But outside, it's different. Even routine doctor's appointments can feel foreign. So Bi usually requests an interpreter to speak her native Cantonese, a language spoken by over 85 million people worldwide.
It is essential to have someone who is able to translate for me while attending medical appointments. If there is information I don't understand, it can be pivotal to my health.
Bi is one of about 148,000, or 18%, of San Franciscans who speak a form of Chinese at home. Almost 90,000 of them have limited English language proficiency, or LEP. But Bi is one of the lucky ones. Many immigrant communities don't have access to the same types of language services. San Francisco's Chinatown is one of the oldest and largest in the United States, dating back to the 1850s. To this day, it's a central hub for Chinese American culture and life, but there are also many resources and services available to this community outside these gates. Northeast Medical Services, or NEMS, provides many of those services. At 14 clinics in the Bay Area, 90% of their patients are Asian. Most are low income and prefer to speak their native language. NEMS offers culturally relevant care like acupuncture and routine screenings for conditions that are particularly prevalent in Asian American communities like hepatitis B. Dr. Amy Tang is the director of immigrant health at NEMS. She says screening for and treating hepatitis and other common healthcare issues here reduces the risk of patients failing to follow up with specialists because of language barriers.
It's really important that we train our providers to manage it in the primary care setting and not have to refer out to specialists every time since it's so common.
Dr. Tang speaks Mandarin, and many staff members are at least bilingual. Most of the patients at this NEMS location are Chinese American.
We can also probe further about maybe reasons for reluctance or understand some of the cultural background norms of why they may be reluctant to try this medication, or their fear about a side effect, or their concern about a vaccine.
I'll choose Lao.
When doctors and nurses can't speak a patient's language, they'll use one of these devices, which connect to interpreters over video or the phone. But calls can get dropped, and wait times for interpreters can drag on past the appointment time.
For instance, I had a patient yesterday who spoke Indonesian, and she, of course, wanted an interpreter, rightly so. There wasn't one available. They said they would call back in 20 minutes with an update, and they finally did. Of course, our visit was already over.
But even patients who speak everyday English can miss out on medical nuances. Melody Shafino is a professor at UC San Diego's School of Public Health.
If your doctor can't understand you, you can't communicate with them, then you're more likely also not to be able to adhere to the treatment regimen. And so what could be something that we can easily manage or manage with proper care ends up becoming catastrophic in many cases.
Hi, you ready?
劉女士，你準備好未啊？我哋可以入去啦。
That's why the gold standard is in-person medical interpreters. Alice Wong is a staff interpreter at UC San Francisco Hospital and is certified in both Mandarin and Cantonese.
So I'm going to look in your ears first.
首先睇睇耳仔裏邊。
Today she's helping a Cantonese-speaking patient get fitted for a new hearing aid. Wong was born in Hong Kong. As a child, her family moved first to England and then to Hawaii. They spoke Cantonese at home.
I think a lot of immigrant kids go through this, where you have to, ad hoc interpret for your mom or for your dad. I realized, wow, I think I could help people that way.
She says interpreters have to convey both the words and the intentions and desires of the patient and the doctor. That can, at times, be hard on the interpreters.
You tend to develop something that we call vicarious trauma. And that becomes quite, emotionally heavy, for me, it's worth it when I realize, oh, I was there to provide that communication, that information to them so they can make better decisions.
Wong went through 40 hours of training to get certified as a medical interpreter, but that doesn't account for years of language and medical study.
As a doctor, you go into a specialty and you know that specialty inside out. For interpreters, we go to different specialties. We jump from one to the other, from maybe neonatal, and then now we're going to cardiology. And so we have to learn all the basics of those terms.
It takes pretty much as much time as it takes a person to become a qualified nurse, a doctor, or any other healthcare.
Natalia Mitreva is the executive director of the Certification Commission for Healthcare Interpreters, which administers the program that certified Alice. Mitreva says recruiting interpreters is difficult, but it's even harder to retain them.
As they get involved more with healthcare, they see the attraction of becoming nurses, physicians, other healthcare providers, and they just move out after being, in the field of interpreting for 3-5 years.
That helps explain why there are so few highly skilled interpreters in the United States. For example, there are 388 certified Mandarin medical interpreters and 177 Cantonese nationwide for more than 900,000 Chinese language speakers who do not speak English well or at all. Several laws mandate that all federally funded healthcare programs provide meaningful access to linguistically appropriate healthcare, but those are loosely defined terms with few enforcement mechanisms.
We really only get a count of self-reported hospital data that indicates, yes, we are offering some level of linguistic and translation services, but the quality of those linguistic and translation services is not necessarily clarified. The problem, I think, a lot of times is that the onus and the burden is on the patient, and that is inappropriate because this is already a vulnerable and marginalized population.
Only 16 states directly reimburse providers for language services provided to Medicaid and Children's Health Insurance Program enrollees. In 2009, California became the first state to require health insurance companies to cover interpretation services. Schaffino says more states should follow suit.
So I think considering something like that, I think would be very beneficial because third-party payers are able to really take advantage of these systemic benefits and economies of scale to really organize and deliver these opportunities.
But unless those changes are made, interpreters like Alice play a crucial role in this patchwork system.
You have to be really passionate to do this.
Yes, it's the passion for language. That's for me. It's a passion for language. The passion to also. To remember where we came from and thinking about, how we came, when we first came here, the struggles we had. How do I help the new people coming in?
I'm going to look in your ears first.
Because when language isn't a barrier, doctors can focus on their primary job, taking care of their patients. For PBS News Weekend, I'm Allie Rogan in San Francisco.